Today we have some great presenters. We're going to be focusing on our navigating medical care within our community. And we have Harmony Health, Ampla Health, and Peachtree Clinic presenting today. And I'm going to go ahead and hand it off to Christina, who will be presenting on behalf of Rachel Farrell for Harmony Health.
Hi guys, sorry, I did have a presentation, but technical difficulties prevented me from showing it today, so sorry. But I will read off kind of the list of questions and prompts that I received. So we are a federally qualified health center, and we are also recognized as a patient-centered medical home. We provide whole person care, patient-centered, of course. We find that when we are taking account of what the patient's wants and needs are first, then care seems to just go a lot better. We currently have 4 locations. Our main location right here, 1908 North Bill Road. We opened our 1930 North Bill Road Wellness Center, which cares for our prenatal population as well as 0 to 12 for like CHDPs, just no like sick visits there. We wanted to separate those 2 populations because they're very vulnerable and everything. So we did that. We have 2 locations in Yuba City, 399 Del Norte and 1215 Plumas. We do have our main location here is open 7 days a week. So Monday through Friday, we're open 8 to 7 and on the weekends, 9 to 2. We do not have, we do not have urgent care, but we do have same day appointments, even available on the weekend. So if somebody needs to get in real quick, then they're able to. Sorry, brain fart. And so the only thing is with the walk-in process, you have to kind of wait to see if anybody no-shows for their appointment. So it can be, somebody can be sitting there for a couple hours technically, but we try our best to work them in. If we're able to double book or however, then we try to get them to be seen. Right now, we are booked out about 2 to 3 weeks for new patient appointments. Follow-up kind of depends on what you're following up on. So usually it's next day or the following day. We do have a clinic on wheels coming soon, so that's super exciting. We're going to be going up to Camptonville. I believe we're going to be trying to work with the Western Farm Workers Association as well to provide them some services. We do have behavioral health, so we treat mild to moderate needs. There is a referral process, so you have to establish care with us first, and then your primary care provider will refer you to our behavioral health department. It's fairly easy. In our behavioral health department, we have a psychiatric nurse practitioner, a licensed marriage and family therapist, LCSW, and a mental health counselor. So that is some of that. We are starting our neurofeedback again as well. Our anger management classes are starting soon. Those are on Thursdays from 6 to 7. We are starting next week on Tuesday. We will be having our recovery group, support group again. All our groups, you do have to be vaccinated to attend. But if you are not vaccinated, then you can Zoom in, at least for the anger management and the recovery group. So just call our clinic for more information on that or to get on the waiting list. There is a cost for the anger management just because if it's court ordered, then they're mandated to pay. So it's not fair if we let some come for free and some have to pay. So we just have everybody has to pay. So We accept most insurances except for HMOs. So that, but besides that, we pretty much accept everything. If you don't have insurance, I'm a certified enrollment counselor, so I'm able to screen and see if somebody's eligible for Medi-Cal, Covered California, whatever the case may be. We do have a sliding fee scale as well. So we're just trying to remove barriers from preventing people from seeking care. And then also, aside from medical care, we also have our Family Resource Center, which we have a diaper closet. I already talked about me helping with insurance. I have an eyeglass program. So a lot of us know that Medi-Cal will pay for an eye exam for an adult, but not the glasses. So a lot of people don't even go and get their eye exam. Well, I have a program that will provide free glasses to that population. I do food referrals. I just started my senior group a couple weeks ago. So that is for Harmony Health patients, 55 and older. They must be vaccinated to come in, but we do a lot of games, a lot of socialization because that's what they're really needing. They have some field trips planned out. We provide a meal at every group. And just try to link them to whatever resources that they're needing. We just met yesterday. It was a pretty good group. I had about 5, so not too big, but it's definitely we're able to talk about what their needs are. Some of them were attending the group before COVID, so they kind of became real close and was able to keep in contact during COVID. So it's nice to see them reunite. I also started my youth group up. It is at the park when it's not too hot, every Friday from 4 to 5, and we do activities. I provide a snack, and hopefully when things start returning more to normal, we'll be able to bring it back into the clinic and do more things like our camping trip and everything else that we have planned. But we definitely provide our primary care. We have diabetes specialist, registered dietitian as well, perinatal care, a birth center here. So really whatever the need is, either we have it or I will link you to whoever does. Like, I think I pretty much covered everything. Any questions?
I have a question.
Yes.
Kaya, hi, thank you for your presentation. So some of your groups are for your clients only, and then some of them are open. Is that how that works?
Yes. So the anger management, you do not have to be a patient of ours. I think that, and the youth group, you do not have to be a patient because we're not indoors, we're outside in the fresh air and everything. And so the youth group and anger management, you do not have to be a patient of ours, but our recovery group and our senior group, yes.
Okay. Thank you.
Mm-hmm. Okay. And then I can send out brochures and flyers and stuff. Sorry, I didn't get to get that either. So I can send that out at a later time.
Perfect. Thank you. I was just scanning the chat, making sure we didn't have any questions in there. And yes, feel free to forward that to me, Christina, and I can get those out to the group.
Awesome. Thank you.
So thank you so much. We're going to go ahead and move on to Cindy from Ampla Health.
Okay. We are also a federally qualified health center, and we're a 501c3. We do provide primary healthcare services to the residents of 6 Northern California counties, which are listed out right there. Here are all of our medical facilities throughout the 6-county region. You can see Lyndhurst Medical right there at the bottom, Yuba County, And then we also have 6 dental facilities, and Lyndhurst is also included. So in Yuba County, we do have both dental and medical in one location. And this presentation, I'm going to primarily focus on the services and the efforts we have going in Yuba County. Here's a slide that goes over all of the hours and the phone numbers for Ample Health, Lyndhurst Medical and Dental, right there on Olivehurst Avenue. Express Care, I'm quite impressed with the fact that we can actually get Express Care people in during the day. It's not just a weekend or after hours set up. So we actually do have appointments for people just to come in for immediate urgent care at any point in time. Appointments, we do book them up to a month ahead, but our providers are really accommodating to patient schedules. Anyone can pretty much get in if they need to get in. And of course, we take walk-ins. So if it's an urgent need, they just need to walk in and we'll fit them in. This slide shows all of our services. If you're familiar with our location, you know that we have a WIC office right next door to the medical and dental building. So we actually, Ample Health actually runs that WIC office there. As soon as the pandemic hit, we really expanded our telehealth operation. So, and it's ongoing, and it's been working for both the staff and the clients. People really like it. Here's a list of our specialty care. Chiropractic services. You might not realize that we do have that service. So a lot of people are taking advantage of that. It's covered by insurance. So we do have medical nutrition therapy. We have the social workers. We do offer transportation at no cost to the patient to our health, to all of the Ample Health appointments. We actually just are in the process of expanding this to all of our regions, but we have had it here in Yuba County for quite some time. Here's a list of our insurances and our programs. Most of you are probably familiar with Medi-Cal and Cover California. I think what I'll do is I'll highlight maybe Path to Health and Connected Care during this presentation. Path to Health is a benefit program that provides primary care coverage for low-income adults ages 26 and older who qualify for Medi-Cal emergency services. So this covers our undocumented population. As far as Connected Care, that is also a program that covers primary care at Ample Health, and it addresses low-income adults 21 to 64. The only caveat is you cannot be enrolled in another insurance. Of course, we provide COVID-19 services Monday through Friday at the Lyndhurst Clinic. You can be tested for COVID and vaccinated anytime during the week. And then Saturday and Sunday, we do the COVID testing. We just don't do the vaccinations. Of course, walk-ins are accepted. And typically what happens is if you do want to come in for a COVID test, they ask you to park your car and wait outside. And if someone calls or comes out and talks with you, and they do the testing outside, so they don't come in the facility. And of course, we make sure we try to accommodate everybody, so there's no barrier relative to having to pay. I did want to highlight the fact that we do have an opioid treatment program. So if you ever come across someone that you think needs to have this type of service, please let us know. And I'm just going to go ahead and jump into the Q&A. I actually don't work at the clinic level, but if you have a question that's really specific to clinic operations, I know who to ask. So.
We do have a question in the chat from Kathy LeBlanc asking if your free transportation extends to the Yuba foothills.
That would be, can you help me out a little bit about, is that like, are you asking like out by?
Dobbins, Oregon House, Camptonville.
Let me write it down to make sure, because I can check with the transportation manager. Let me write
That
down
would
the
be-
specific areas that you're talking about. That way
Yeah.
I know. Go ahead. What areas?
It's the upper Yuba County foothills. It would be
Upper?
Dobbins, Oregon House, Challenge, Camptonville, those areas.
Robbins, Morgan House. Yeah, I do not believe so. I don't
Okay.
think they go out that way, but I will
You're-
find out
you're-
for sure.
Okay, I appreciate it. You would not be the first not to come out this way. I was just listening with hopeful ears. Okay, thank
Yeah.
you.
Now, what would be the closest clinic to that area? Would it be the Olivehurst Clinic on Olivehurst? Would that be the closest one?
The closest Amplet clinic
Yeah.
is probably, yeah, we do have Sutter Health, I believe, in Brownsville, and we have the Sierra Family Medical Clinic in Oregon House. There may be others that I'm missing, but those are the top. And then we have the Harmony Health medical van coming to Camptonville. So, we are getting some coverage, but, anytime anybody's offering free transportation, I'm going to ask that question.
Yeah.
Thank you.
I will find out for you. I don't recall them talking about those locations or going to those locations, but I'll shoot an email to the transportation manager today and ask them if they do travel up that far, and then I'll get it to Liz and she can get it to you.
And then I kind of have a question to piggyback off of that. If there isn't transportation that goes all the way up to the foothills, would it be possible that your agency would be able to maybe meet halfway and work something out with, the community that's in the foothills?
We don't say no flat out to anything. We look into everything. So I'm gonna ask her about that.
Thank you.
Mhm.
Oh, and I do have one more question about
Yeah.
transportation. Is the transportation only from, the individual's home to AMPLA, or if the individual gets a referral to maybe another hospital, would they also take them to that hospital, or is it only AMPLA facilities?
It's only AMPLA, but they don't have to be picked up from their home. Like we actually pick up quite a few homeless people, and they might be at the address right over here, the Hands of Hope. They might say, pick me up there. So
Okay.
we pick up people wherever they want to be picked up. But it is just for AMPLA appointments. Yes.
Got it. Okay, it looks like we don't have any other questions. So I'm moving on to Michelle from Peachtree Clinic.
Hi there. I'm not going to share a presentation. I see AMPLA is still up on the board. I'm going to start by
stop that. How do I unshare?
You go up to the top and there's
oh, stop. There we go. Stop sharing. Okay, thank you.
So I apologize, and I'm going to have a word with my boss. I didn't know I was doing a presentation today, so I will wing it and give you some information about Peach. So as I listen to our other two colleagues, so much of that rings true to what we do. When you're a federally qualified health center, you are governed by the federal government, more or less. So we have things we can do and can't do. So a lot of what we do is duplicated. But as I hear Cynthia and Christina talk, they have some different specialties and things that we do not. That transportation, that's great for the community. It's a big one for us that we're unable to offer. So we have a clinic in Live Oak. We have one in Yuba City. North Sacramento, we have a very large clinic there off of Northgate near Truxell. We have our hub, which used to be in the old mall, which is now by Yuba County Health and Human over in Marysville, very large clinic. We have a dental van that is stationed in Yuba County at the schools. And it's been just amazing, the service we can provide for the students and the siblings of the Yuba County residents. Many of them have never even had a toothbrush. So it's been amazing, and we've been doing that for some time now. We have vision centers within our clinics, and we have 2 standalone vision clinics, one up in Oroville and one in Chico. So we are able to serve the Medi-Cal children and adults who were, otherwise often unable to get that service, and refer for cataract surgery and other surgical needs that they have. So we get, we share patients back and forth. AMPLA sends us some for that specialty and we send over to them, and it works out really well. We have an immediate care that some of you might have seen it. It was on the Rideout Adventist campus for many, many years. We did lose that lease last summer, and we moved our immediate care into our Linda Clinic on Packard. So we still have an immediate care 5 days a week, and we're actually expanding hours on that in the hopefully within a month or so to Saturday clinics and later in the evening. We offer many duplicate services from the others, but there's plenty of patients to go around. As Cynthia and Christina mentioned, there are wait times getting in if you're a new patient, and we have the same issues. There's not enough providers and space to go around for the patient needs in our communities. You might wait up to 4 weeks to get a new patient visit, but we would never say, we're not going to see you for that sore throat because you haven't established care. We're going to get you in same day to be seen for that issue. And then you'll come back, we'll get you scheduled for that later new patient visit, which typically takes, a 30-minute appointment. We have a very large behavioral health practice, and we station LCSWs within each of our clinics. We also have LCSWs that work strictly telehealth, and all of them incorporate telehealth. I don't know about the others, but we've seen a decline in no-shows because we are able to offer telehealth specifically in behavioral health. That was a high no-show, and it's just statistically been that way for us since day one. And we will continue to do telehealth as long as we can for every specialty, for family practice also. But it's been really great. Some people with behavioral health issues, they don't want to get out of bed and drive into an appointment. And if all they have to do is sit at a table or whatever, it's worked. So we are really excited about that. We have psychiatry through telehealth. We do not have any psychiatrists in our locations at the present. We offer podiatry, diabetic management, acupuncture, of course, dental, pediatrics, OBGYN, cardiology. So, we kind of duplicate services, like I said, but we just don't have enough slots in the day for these appointments. So we know that that's okay that we're duplicating. We are a COVID vaccine site. We had a very large program set up in the parking lot in Yuba County. They were kind enough to let us use that space. We've now moved it indoors. And as most of you know, the immunizations have declined dramatically. So we're not doing near as many as we were. We work with Rideout Adventist to capture the ER patient follow-ups. So we get a list from them. They go through and tell us this person is assigned to you and this one, and they need to be seen within 72 hours. So we have, all of our providers get those patients in to be seen, so they're followed up from the hospital. We're now new to us is working with the hospital for inpatients who are being discharged. If they are assigned to Peach, or maybe they're assigned to AMPLA, you know, then they get them. But if they don't have an assignment, we're now working to capture those patients, because right now the ER said they end up back in ER because they don't get their follow-up meds, their follow-up treatment. We have pharmacies. We have one within our clinic in Marysville, and then we have partnerships in Live Oak and Yuba City with pharmacies. We provide what they call 340B drugs. So it's a discounted, well, almost free discounted program for the uninsured patients. So they definitely can come in, be seen, and pay a very small amount for any prescriptions. We also have a sliding fee program, which of course the other FQs do also. That means there's nobody, we don't turn anybody away. We see everybody. Sliding fee allows us to have the patient come in, and if they have no income, then they're not going to pay. But if they have a little bit, then they'll pay a small amount. That money covers x-rays, pharmacy, sometimes the draw station, and their visit. So we are, you know, that's one thing about an FQHC. We are here to serve the underserved, and we don't turn anybody away. You always say yes. So, you know, just some of the same things, case managers, we have people helping with eligibility that specialize in that. And I think that's all I can come up with off the top of my head. Since I wasn't prepared, I apologize. I don't know if anybody has any questions.
I am curious if, and this could be a question for all three of you, do you have any programs specific to new pregnant moms?
Yeah, we are part of CPSP, so that program is for pregnant and new mothers, and that is a state program. We do not currently have, you know, group type things. I'm not sure if the rest of you do.
So with our prenatal population, if they are going to deliver here at our birth center, then we do provide Lamaze as part of the CPSP program. We've incorporated it into that. We used to have our home visitation program, which would be during pregnancy up until the child is 3 years old. Currently, we do not have that. We are looking to hopefully start it again soon. Should funding come through and we have enough space. Kind of we're waiting for our new building to be built, and so we're kind of like at capacity right now. But aside from that, I am looking to start like a mommy and me group, but just not yet.
Yeah, I would say you know, we're really appreciative of the two partner agencies in the area, because we really do not focus on that type of care. So, you know, a lot of our patients go to Harmony and to Peachtree. We've put some eggs in the opioid treatment bucket. We have the pharmacies inside our clinics now and some of those types of services, but we're really appreciative of the two that are speaking today, because they really do have that type of service.
Thank you. Are there any other questions? Okay. Well, I really want to thank all three of you for participating in today's convening. It was definitely a lot of great information. And yes, if you have any resources that you would like to share, feel free to email them to me and I'll get them out to the group. On that note, we'll go ahead and go to our next step, which we wanted to talk about what we would like to see for future convenings. We, you know, originally we're thinking potentially holding our next convening in person, but with numbers rising with COVID a bit, we're thinking we'll probably keep it via Zoom. But what would you, our community partners, like to see at our next convening? In the chat, actually, Jamie Bartolome is going to share her screen. And we were hoping to maybe do a word cloud to kind of pull out maybe different type of topics you would like to see at the next convening. So I'll let Jamie do her thing.
We'll see if this works. Bear with me. Okay. Can everyone see the top where it says where to? There.
Yeah, Jamie, could you drop that into the chat box?
I can.
Awesome, thank you.
Maybe. Let's see.
I think if we use our phones, right, to text to that number, 22333, and you text UBA
UBA 58.
58. Yeah.
Mhm.
And then it gives you a link and then you respond to it.
So really, we want these convenings to be useful for all of our partner agencies. We've really focused on transportation and our medical facilities and substance use treatment facilities. And our focus has been to look at the access to services. So what are different type of topics or different type of services that you think would be beneficial for us to discuss on how to better improve the access to services for people within our community?
One thing that we're really challenged with, I guess, from my perspective, being in charge of outreach, we thought we were kind of opening up and being able to go out and do events, and we actually started. And now I feel like we're backtracking. And one of our goals is to reach people about COVID vaccination. But the challenge is, how do we do that without putting our staff at risk? So I feel like I want to do a good job on the outreach piece. We do have eligibility workers in each clinic to get everybody on insurance. And remember, we're offering the COVID vaccinations for no cost to the patient. But actually, it's just such a tug of war to get everybody vaccinated, and it almost requires going out and talking to people. But then how do we do that without jeopardizing our own safety and the safety of all the people that live in the clinic? So I don't know, I'm just throwing that out there if other people are kind of struggling with that.
That's a really interesting concept to me, Cindy, because I've heard suggestions of doing a mobile service where potentially people could go out to people's homes, but then yes, we have to think about the safety factors for our own employees. I am curious, have other agencies talked about that? I'm not sure if our public health has. Maybe Kaya can chime in on that a little bit, but yeah, has there been any discussion on that?
I'm kind of removed from those discussions, even though I'm public health, but a lot of that is happening at the Department Operations Center with Dr. Liu at the head. So I apologize, I don't have a lot of that.
I know Dr. Liu is very good about still continuing with the meetings, and that include, the executives and medical officers from our different clinics. And then, we push out the message, but I know the county's done a great job, and so is Sutter, about getting the word out to individuals. And you're right, though, for now, we're looking at, we probably can't go to these different health events right now. Because of what's happening. So it is harder to get the message out, but I think the counties have done a great job.
I mean, I had one of my staff do an event and they were vaccinated and they got COVID. So I don't know. I do think though that it's a little bit challenging because the world is kind of opening up, not wearing masks, and a lot of people did that, right? Because that's what we were sort of that's the mode we were in. So I don't think the person wore a mask at the outside event. But now I feel like if we do any outreach, we all have to wear the mask again, and even though we're vaccinated, I think that's probably how I'm going to have to do my job, or do the outreach from this point on. I think we're all gonna have to mask up again. And I don't know. I'm actually gonna have to have a talk with management here, because I'm challenged by what to do.
We actually have a couple employees who have been fully vaccinated for some time that are now positive for COVID.
Yeah, our mask mandate never went away. So we've always still been required to wear a mask. Even patients coming into the building, they are still required to wear a mask.
Our clinic.
Well, so are ours,
clinics
yeah,
had,
healthcare, you
So-
have
that's the
to.
mask
right?
thing, but it was
right.
it was in outreach, it was in administration, different places like that, but our clinics definitely
Right.
kept up with the mask.
Yeah.
I think you brought up a really good point, Michelle, that I think we as a community and our agencies have really worked well together in trying to get that word out. And it's, I definitely think we're still looking at ways to still get that word out and still have access, get that access to COVID vaccines, to up those vaccination numbers for our county. But I agree. I think there is more that needs to be looked at that.
We just started a partnership through the state relative to the Navigators program. So we did hire someone to do Medi-Cal and partnering with Yuba County. So part of her job will be to go out into the community to try to get people to enroll in Medi-Cal, and also of course be vaccinated.
Are any of your facilities doing any mobile vaccinations?
No, we the only mobile clinic we have is in the Chico area, and it only serves homeless. That's our only mobile operation. And we do have back here in back behind the Yuba City Medical Clinic, we have like a whole trailer where we do a lot of COVID work, but it's not mobile. It's just in the back of the facility. But we try to segregate it so that we're not not allowing people that are actually active to come and walk around the clinic. So we try that, but we don't have. And then the same thing with going out to the car to do the testing. And we try to do things like that, but we don't actually have a mobile clinic in Yuba County.
So Yuba County Health Department was doing that. They were going, someone else might know more about that than me. And it kind of started up right at the time when the vaccinations were declining. So I don't know if they're still doing that or not. They were going to be going to the foothills and different areas doing vaccines.
I know that they've done a few for our homebound individuals, but I'm not sure how much they do.
So we were able to go up to Camptonville a few times to provide vaccinations up there. With our mobile clinic, we will be providing vaccines as well. The only thing is I don't have an exact date as to when we're going to start the mobile clinic. So
The problem, as you all know, we were at that point where we need vaccines. We don't have enough. Now we have too many, and we don't have enough patients to give them to. So
Right.
luckily, most of them have a long shelf life, but we'll hit a point where they'll expire, because, and we are asking patients now, it's not just being done at a vaccine clinic type thing. You have a patient come in that, if they're not vaccinated, we want to vaccinate you right now. They have really strong opinions, and it's just not, right now it's not working.
Right.
The opinions really are all over the place. You just
Do the opinions seem to be fear-based?
just like all kinds of stuff.
It's a mixture. A lot of people say, I want to wait and see what it does to to you or someone else? What happens to you
And a lot,
as a
and lot
result
it's
of
like
getting it?
political and
A lot of it.
conspiracy related things, and you're just like, okay.
Yeah, I've had somebody ask me to put a magnet up to my arm where the injection site was, see if there was metal in there, I guess. So yeah.
Interesting.
Yeah.
There is, when you register for the vaccination, there is an option if you can't get to a clinic due to health or transportation issues, then they'll either arrange for an in-home visit or for transportation. So that's an option when you register online.
Mhm. That's great.
That's good to know. I didn't realize that.
Yeah.
So the government's new, the governor, his message, it's not a total mandate yet, but we have been reading that with a fine tooth comb. And what it does look like is, even though we're not state or anything, it does mandate that healthcare facilities, which is what we are, your employees have to either show proof of vaccination or every week they have to have a test. So we have an 84% vaccination rate of our employees, and most of those that aren't would be more in a outside of the clinic setting. Most of the clinics, their employees are all vaccinated.
Yeah, I don't
But
know.
I think this might push some others to say, I'm going to go ahead and just get vaccinated if I have to go through that every week.
How do you handle it? Like, I have some staff actually in outreach that say they can't for medical reasons. How do you
Then that's okay, but they have to show proof of that, and then they have to just wear a mask. And that is not spelled out yet if they have to be tested every week or not.
Oh, okay.
Yeah.
Well, I mean, they probably should. It's probably the same, in the same, how do I say, safety.
Right.
Right. And it also is stating in there, we're trying to get more information, that you have to wear PPE. That's not just a mask though. That would be in the N95, which
Right.
are in short supply. So we would hate to have to do that, but we'll do what we're told.
Wow. And they're hard to wear for a long time. The N95 ones, right? I mean,
Right. They're uncomfortable.
and we have the surgical masks, but I don't think they're N95. But I've worn one before, and it's hard. I mean, when we had all the fires, remember all the fires?
Well, I see it outside my window right now.
You know what? I noticed it
County,
today.
it's like
I feel so terrible, but I've been so busy. I don't even know where the fire is. Where is the fire? Because I saw the smoke and I came in and I got busy and I didn't look it up. Where is it? I can
It's
see
up
the
near
smoke.
Quincy and up that way. I don't know if
Okay.
that's the smoke we're getting, but I guess it's that one.
Wow.
So on that note, I thought I saw someone unmute themselves, so I wasn't sure if they were going to say something. Okay, we're muted again. On that note, so it definitely sounds like we have some really good discussion to talk about with COVID outreach for our community. I also saw on the word cloud that treatment was brought up. That seemed to be a big word. One was substance treatment. I don't know.
You want me to share the screen? You want me to share the
Sure,
screen?
yeah, go ahead. Yeah, thank you, Jamie.
I did forget to mention in my presentation that we do have a MAT program for opioids and also alcohol use disorder. So, and we also partner with the hospital for the Bridge program, so they can initiate care there and then follow up with us.
Christina, I forgot to mention the exact same thing. So we also
Yes.
provide that. There's a huge need in this community for opioid addiction treatment. So there's enough to go around.
Absolutely.
Can I just say something? So like, so there's so many good resources, and there's so much, right, that we provide to folks. And we're having this conversation in the homeless arena, like, what do you do when someone is not quite ready to access services? And I think for a long time we've said, oh, there are no services. It's really hard to access services. None of these services are available to our folks. But that is not the case, right? That there are all kinds of services. There might be a little bit of a wait time, but there's if you are in need, that you can most likely find what you are needing. The issue comes when, and this is a whole nother conversation, but like the issue comes when folks are not quite ready to access services. So we can have really good behavioral health treatment, we can have really good substance use treatment, but but engaging with the folks that we serve on a day-to-day basis to start having those change conversations and to facilitate change in their thinking about treatment. Like those are things that goes right along with access to care, because if the client is not in a mindset that they're ready to access care, they won't do it.
So
As we think about access, I just want to keep that in mind. Like it's also there are other barriers besides just there are other access barriers besides just like a lack of services or a lack of knowledge, or like there is a self-imposed access barrier, I guess.
right. So we definitely try to meet them where they're at. And that's why I said, like, an example, we had a provider, and every once in a while, a provider will share some of their stories. And so they had a patient and they came in, heavy meth user, but he was coming in because he wasn't breathing well. And so we addressed that. And yes, of course, we addressed his meth use, but at the time, that's not what was important to him. So building that trust and that relationship with our patients is the first step for sure. Because once they realize that we have their best interest, or yes, sorry, brain fart, that we want the best for them and they're not just another number making us money, then they're more likely to say, okay, yeah, I do feel better. Okay, well, what else? And actually take our advice and want to change other things.
Yes, this is this would be considered the hard to reach population, the people that just don't want to come in. Every excuse in the book, and the challenge is that historically the way we would reach those people would be through our promotores, or people that go out and have like a one-on-one conversation and build relationships. And that's what's challenging, because that requires closeness. And then that's why I feel I'm a little bit discouraged about the situation, because I just feel like the way to reach these people, to get these people in, is closeness and relationship building, which is exactly what we probably can't really do right now. So it's a little upsetting to me trying to function and get these people taken care of in this environment. Obviously we wish we could just go to sleep and wake up and say this is all a dream, but it's not, it's reality.
I'm curious, because I agree with connecting with our clients. I see education and resources and learning. I think those are all really key components when we're working with our clients, and making that connection with them. And with COVID and us trying to, keep ourselves safe, has anyone had experience having any type of texting communication or email communication with their clients?
We actually have done a lot more. Well, our latest focus was on the American Rescue Act, trying to get that out, because a lot more people are eligible than were before. So we've done the Comcast, the Conquest, whatever, to the phones and billboards and all of that. So but that's just there's so many needs. That's just one need. And we're trying to use social media. Now, whether it's going to work, I don't know. But I mean, we probably do need to do a little bit more texting, like you said, to our actual patients.
So one thing to keep in mind, we do texting campaigns too. Of course, those only go to our patients. So the way, and maybe everybody knows this, with the way managed care plans work, they assign patients to us. So they assign a chunk to us, they assign a chunk to AMPLA and Harmony and whoever else. And then that's who we get. If that patient comes to us and doesn't like us or can't get in quick enough or whatever, they go through a process through their managed care plan to change And it's not super easy. In the old days, it used to be, it's not as easy, but then they change who they're assigned to. So then there's the other piece of that, which is our sliding fee that we all take, the sliding fee patient with no insurance, you know, and they can just come in and of course they have the same, unfortunately, wait times as anybody else to get in. But there's so many, there's such a huge population of those that aren't seen by any of us, that texting or any of that is never going to get the message to them. So it's flyers at homeless shelters, it's billboards, like she said, and just having word out there in the community, because there are church groups that do go to the river bottoms and feed homeless people and do things like that. It's not always a message that's real easy for us to get out, but the community can get it out that those services are there. And they do come in, homeless patients do come in for all kinds of service.
That's a really good point, Michelle. It makes me wonder if we need to be looking at, key community, members that we could be partnering with, more beyond, just, our agencies, but yeah, speaking with, faith-based groups and individuals who are able to connect with that group that we can't quite reach because they haven't gotten to that point of registering with us and all of that great stuff.
Yes, I mean, we just have a recent partnership with Yuba Center Homeless Consortium to try to reach the homeless, to get not just only to get them vaccinated, but to get them into the coordinated care where they can really get going and eventually get into a house. There's just so much need, and I appreciate your point about collaborating, because honestly, I probably am doing more collaborating with other agencies now than I ever have before. So it's so hard to get all these one-stop shop things going, but collaborating with other people that serve certain populations works out.
Okay. Yeah. I feel like we're having really great discussion, and I'm realizing we're coming up on 1:30. I don't want us to go over. So thank you for everyone who has participated in this discussion. Thank you to all of our presenters today. I know I definitely jotted down some really great notes. And I just want you guys to know that our team, the Community Needs Planning Committee, will be going back and discussing this further to look at what our next steps will be for our August convening. If you have any additional thoughts, feel free to email me or call me directly. I'm happy to share that with the group and look at incorporating that, because we definitely want this to be a convening that is useful to all of you, our community partners. So with that said, thank you everyone for attending today. I'm going to give you 3 minutes back of your time and I will see everyone next month. Thank you so much.